Hello, everyone. I'm Samantha, the Director of Patient Advocacy and Outreach at Hail Mary, and I'm honored to introduce our guest today, Kelly Nichols, the Manager of Advocacy and Engagement at the Respiratory Health Association. With a diverse career serving in various roles that started in performing arts, Kelly took a turn into science and research and is now focused on community and environmental activism and outreach. She's a passionate and dynamic mission-driven leader who is making an impact and creating positive and meaningful change in her community. Welcome, Kelly. Thank you for being here today.
Thank you for having me, Samantha.
Yes, we're so excited to have you. So we'll jump into a question just to talk a bit more about the Respiratory Health Association. If you'd like to tell us a bit more about the organization, what you're currently doing, and why is this work meaningful to you personally?
Yeah, the Respiratory Health Association is a public health leader since 1906. It started as an organization that was working on tuberculosis, which was a prominent health threat in the community that it was located in, which is primarily Chicago and the state of Illinois. As the health practices and treatments and medicines and environmental factors have evolved, so has the organization. Today, we look at asthma, COPD, lung cancer, tobacco cessation and control, and air quality with a really comprehensive approach. And we have a lot of history of some really great milestones, including some elements that have helped out with Smoke-Free Illinois and some work that we've done with cancer screening and COPD education and patient advocacy. And our biggest mission is that we want to prevent lung disease, promote clean air, and help people live better through education, research, and policy change. And we want to do that especially through a lens that focuses on evidence-based community health and centering equity in health. And so that's a big part of why we do what we do. And we're very active throughout the state of Illinois, and we do also do work nationally in America. And we work really hard in all of our issue areas, having highly educated staff that work to connect people with the resources that they need to learn more about lung health issues. We also have a component of our organization that does events to raise awareness on lung health issues. We do a hustle up the Hancock, and we do a bike ride every year called Cowalunga, in addition to volunteer recognition nights and a bunch of ways that we can come together as a lung health community to talk about lung health issues.
Wow. So a lot of amazing, important work in the community, from events I've seen to, resources for patients. There's just a lot of way for patients and their families, or even just the general community, to get benefit from the association, which is really great. From your experience working in this space and kind of coming into it, what don't we know about our environment that impacts our lungs, would you say?
Yeah, that is something that is kind of my personal passion, which is one of the reasons that I became involved with Respiratory Health Association. I come from a background of environmental organizing and environmental advocacy, and the focus that Respiratory Health Association had on the overlap of lung health issues and environmental impacts was really important for me. I've worked in communities in and around Chicago and the state of Illinois. At the previous place that I worked all over the upper Midwest. And though different kinds of modalities exist in those other places, different kinds of, city structures and governmental structures, you can't control the air quality where you live because air is shared, right? There's no boundaries. We have municipal boundaries, but we can't, contain the air. So one of the things that's been really important is really understanding comprehensively how air quality impacts health and people. And for me, a really big thing that I'm passionate about right now is learning how to really have the discussion in a clinical space about how air quality can impact lung health, especially people with chronic lung health issues. It's come up a lot in webinars that I've seen and people that I've talked to. And I know that this is a generality, but in oftentimes people in the world of mental health, like people who track environmental air quality issues, don't often connect with people who are in the clinical space speaking to patients about air quality issues and their impacts on lung health and lung health exacerbations and symptoms that may appear in people's chronic illnesses that they don't know are necessarily linked to exposures either inside or outside of their house. So it became a real interest in mine personally about how to integrate that message as a person who works with advocates and health
Mhm.
professionals, to have a space to talk about that and to really, really understand it.
Yeah. Wow. That's a really cool perspective. And that you talked about the environmental research, right? And then linking that to the clinical space to get awareness for patients where it's needed. And so um, Respiratory Health Association does that through resources, events. Is that correct?
Yeah, we do a lot of outreach in my department, advocacy wise, to educate people. We have a great list of advocates that we call our health professionals for healthy lungs. And we communicate with them about air quality issues that we have found and ways to link it into the issues that they're working on, as well as other overwhelming policy issues that directly impact lung health, like Medicare funding and availability of drugs, and conversations about tobacco cessation and banning flavors in e-cigarettes. And it's very comprehensive, but we want to make sure to include environmental exposures in that same bucket so that we have a link that people can establish with patients to really talk about things like that. And since I've come to RHA, we've been able to link that. We've been able to continue to link that into the advocacy work that we do, but we have a really robust staff that really comprehensively understands that overlap and brings it up at every opportunity. One of the things that I love is we usually do an annual conference. It's been pushed online during
Mhm.
the pandemic because of how much we want to protect the health of our constituency, who often have chronic lung health issues. But it's an annual COPD conference where we make sure that people are really understanding that. And I think COPD is a complicated disease because oftentimes, historically, it's been linked to behavior and behavior modification and cause and effect frequently with smoking and smoking cessation. But we, as
Mhm.
an organization, really want to make sure that there's no stigmatization around the illness. We want to make sure that people understand how to care for themselves, how to communicate with their healthcare team. I mean, I think it's really critical to have those conversations, to link them with environment, to let them know that exacerbations maybe aren't just in their head or just in their home, and really understand comprehensively how to assess and communicate with healthcare professionals about what their needs are. One of the things I'm really proud of that I wasn't directly involved in, but that I promote at every opportunity, was our COPD Caregivers Toolkit, which helps because a lot of people who have COPD have caregivers that live in their home or care for, manage their own care. And the toolkit is a really great combination of resources and checklists and questions to ask that allow people who are in the middle of a disease process to be able to handle things with a little bit more sort of bird's eye clarity, to make sure that they're understanding what's happening in that clinical space with their illness. So I'm really excited about that kind of work we do, and the educational components about all of the issue areas that we work on at Respiratory Health Association.
Wow, that's incredible. The more you bring up different events, it's really cool to see all the different areas that you specialize in, but still have like such a broad perspective on lung cancer and air pollution and everything. I know you brought up COVID and the pandemic, putting the conference online. So I'm just curious to know, did COVID increase awareness for your organization and the work you're doing, or did it overshadow what you were doing, or was there a different outcome when it comes to lung illness?
It did increase awareness. We noticed, of course, when we were looking at who was viewing our website and what kind of information they were looking for, we did notice a definite uptick in people who wanted to find out more information about this thing that none of us really knew even as much about as we know now. And because of that, one of the areas that we're focusing on now is really a look at understanding COVID and long COVID, especially as it impacts our patients that are our constituents that are struggling with other lung health issues, and how we're really peeling back the onion on this illness that we're all learning about in real time. And it's definitely an interesting process, especially, and you were talking about this just now, the way that Respiratory Health Association has a lot of issue areas really makes me stay on my toes as a person who works on advocacy and engagement to make sure that
Mm-hmm.
people are not siloed in these issue areas and understand this overlap, and we can create that community that can come together to talk about these issues and to understand how it impacts all of us. But COVID has definitely been, I mean, we're there, it was kind of a double-edged sword. We were able to get more information to more people. People were coming to us for more information. Um, it was we were constantly looking at ways that it was going to impact our constituency so that we could make sure and give them all the information that we have without out competing other resources that are at the front lines, like the CDC or the WHO or our state and
Mm-hmm.
local health departments. But we wanted to make sure, one of the things that I love the most about RHA is the sense of community that we create, so that we want to make sure that for our community, they're getting good information, or they know where to find good information, so they can still feel connected to that conversation
Mm-hmm.
with our organization and within their own community. That said, especially because so many of our constituents don't necessarily have as much ease leaving their homes as people who don't have lung health issues, the pivot to be able to do a bunch of stuff online actually made some of the advocacy work that we do and some of the conferences that we hold more accessible to people. So we were able to get the message to more people because they were able to get to where we were. So for my job, I had legislators that were suddenly agreeing to Zoom meetings where in the past we would have had to drive 4 hours to the capital of our state. And that is a trip that people with COPD or carrying oxygen tanks have a very difficult time making. So allowing for that accessibility has been a huge part of like the double-edged sword that has come with COVID, right? Just making sure we take care of our community, bringing our community closer, but also almost providing more access for people who typically don't have it in the lung health space to be able to
Mm-hmm.
create change in policy.
Yeah. Wow. That's a great perspective to see how, yeah, even though it was obviously a negative time and, there's a lot going on, that there was some positive and accessibility to resources
Mm-hmm.
that you're able to provide. And I guess, yeah, even before COVID or during COVID, have you seen personally in your work specific barriers for patients or their caregivers when trying to access information or resources? Is there anything that stands out to you as maybe a barrier, whether it's knowing where to look, what to look for, overwhelming amounts of information, or anything like that?
I think it's really a combination of all of those things, depending upon the lung health issue, right? Because there's generally a narrative that overwhelms the conversation about a specific issue. So, one of the things that I feel when people come to us and say, "We're glad we found you," is that our organization tries to help provide appropriate resources and directions without really overwhelming our constituency, and giving them the personal relationship that I have with my advocates really makes me feel good about them coming to me and saying, "Help, I need this information." And me being able to talk to the rest of the staff and go, "Where's the best place to find this information? What can I do?" And have our health professionals go, "What are people asking you for?" Like that communication and that overlapping of our constituency has really helped us be able to cut the fat of some of the stuff that makes headlines on the internet and make sure that people are really getting the information that they need. Like we've partnered with an organization to help with lung cancer clinical trials. We created the toolkit for COPD. We are providing education in schools and public settings with children to talk about asthma and vaping and all kinds of stuff. And we work really collaboratively in coalitions that are local, state, and federal to help make sure that we're up to date and not being reactionary, but proactive to help people gather the data that they need to make the choices that they need to make about their health. But also, for me, to make the choices about their advocacy, right? Like it's something that when you link it together, someone with lung cancer or someone with COPD or someone with asthma can say, "Wow, I had no idea that this was important or that this does impact me." So I
Mm-hmm.
feel like that's part of what we do too. And I also think, just to stick on advocacy for a moment, one of the things that I think I'm working on educating people more about is not necessarily getting mired in legislative and policy process, but also really understanding that when we see a big bill pass, like here in America in the Inflation Reduction Act, or here in the state of Illinois, our Climate and Equitable Jobs Act, some of the policies that passed, we had a stock albuterol piece of legislation passed in 2018. And that's the one that I use a lot for the example that I give, is that we all get excited and we think we can throw our protest signs down and move on with our lives. But what I want to make sure that people know is that that stock albuterol legislation that passed 4 years ago only got funded in 2022. So we can't implement anything until it gets over the finish line. So having people really understand the process so that they're not going, why are you still talking about this? Or why should I care about this? And saying, because we want to make sure that for lung cancer screening, people understand that there's legislation about low dose CT scans so that they can have early diagnosis. There's things that have to happen to get us over the finish line that always look like they're done before they're done. So making sure people really understand that it's a process, just like a treatment process for a disease, that you have to keep going, that it's not automatically a win, and that the process is long. Luckily, we have a lot of really engaged advocates that are well educated and love to talk about this kind of stuff, so that it keeps it really relevant in front of legislators and policymakers' eyes, so that we can keep these balls moving forward and work best to create and support policies that exist and protect people.
Yeah. Wow. I can hear the passion in your voice too. And just from your experiences, and obviously you've been an advocate in this space for so long and even before. So I'd love to know let's go back a little bit to your introduction, but what is your background? How did you get here? And what's the why behind the drive that makes you do this work?
For me, it was kind of a combination of a lot of things. So my degree's in theater, but while I lived in New York and was trying to make it as an actor or performer, I worked, one of my day jobs was at Mount Sinai School of Medicine. I worked as a research assistant on a couple of really great studies. One was on the effects of the World Trade Center disaster on pregnant women and their infants. And the other was the impact of phytoestrogens and environmental exposures on early puberty in girls in East Harlem. I'm sure I'm butchering the name of that second study. It was a very long name. But I worked basically on environmental exposures and people's health, which I had no idea would come back to me as after I had my own children. I found myself really sitting at home, kind of falling down Google rabbit holes, worried about my children and worried about their future. And I decided that as a mom, I really wanted to take action, which led me to my first organizing job with a national nonprofit called Moms Clean Air Force. And I found that my fear was really allayed by action. And the more I dove into the work, the more I was like, wait, I know about this stuff. I used to work in this world when I was looking at environmental exposures and their impact on health. And I was like, oh man, this feels really right. This feels like exactly what I'm supposed to do. And then when you combine that with my excitement and desire to be in front of people and publicly speak about things and get very excited about things from my performance background, and probably also because I'm the youngest child in my family, I really felt like this was the right niche for me. I really wanted to make sure people understood and I could communicate that to them. That said, with great information comes great responsibility. And a lot of the stuff that I have learned in two big buckets. One is environmental justice and the difference in exposure in different communities, and also the really comprehensive approach and look I've had at lung health through Respiratory Health Association has made it so that my eyes are really wide open now. And I find that, I think when you can be aware of that, it really does change your life and change your outlook. My lens is completely changed, and I can't go back to being ignorant about a lot of stuff that I was ignorant about in the early part of my life. And that is really, really critical to creating change. And that's part of what is now like my passion grew into this space, but what continues to fuel it is really communicating so that people understand comprehensively how we interact with the world and why it's important to be part of the mechanism that creates change, even if that part is supporting a friend who has lung cancer, or taking care of the child of someone who is marching in a protest or something like that. There are a lot of roles that a lot of us have to play in all of these avenues, and all of them are really of critical importance. So that's something that has kind of been my full journey. And hopefully, again, since my entry point for this work specifically was as a parent, my hope is that my children I have 10-year-old twins, my hope is that they can look at me and understand the part that they will have to play moving forward in the world to really be conscientious citizens and move forward and know their part in the world and what they have to do to create and be a part of the world that they want to.
Wow, that's very inspiring. And yeah, it was really interesting to see your career from like creativity, Broadway. Well, you still had that research background there, I noticed. And then that come back full circle almost by accident. But can definitely see you're passionate about what you do. Through your work, even before with the was it Mom's Clean Air
Mom's
Force?
Clean Air Force. Yep.
Clean Air Force, yeah, or Respiratory Health Association. Do you have any stories or like stories of your own experience, stories of patients you've interacted with that stand out to you?
Yeah. I've been blessed to work with so many advocates. One woman that I work with through Respiratory Health Association, she had a lung disease that required her to get a transplant. So now she has one functioning lung that is from a donor, and she's very passionate about air quality, and she's also passionate about other lung health aspects. And I've spent hours with her on the phone to really dig into the things she wants to share with me about her life. One thing I've learned from her is that chronic illness of any kind, be it COPD, lung cancer, or the issues that she had that required her lung transplant, can be very isolating. So making sure that you listen and you can help people engage and understand how to create change, even if they're limited in their ability to do it, was really important. And she taught me that, there are many things that keep her from being able to feel comfortable in the world. The big highlight right now is COVID, of course. Like, she has one working lung, and she's told me many times she's outlived her transplant. So she's very, very cautious about entering shared spaces and really exposing herself to things that could make her more vulnerable. And she has some other systemic issues that have come from being a transplant patient. So she's very cautious. But, she felt, when I first connected with her at the beginning of the pandemic, she felt really disappointed that she couldn't help in ways that she traditionally liked to because of what was happening with the pandemic. And I really loved the ability to connect with her and say, wait, there's plenty you can do. Do you want to hop on a Zoom with an elected official? Do you want to speak at this online press conference? Do you want to help people understand how the vulnerability of your health has made you really truly understand some of the impacts that people don't even think about, another thing about if they have no health problems or healthy lungs? And that has been so helpful for me, but also I think helpful for her, because she said that it makes her feel at a point where she's kind of continually isolated. It helps her to feel a lot less isolated and a lot more connected to people, even though at the moment she's kind of housebound, And for me, it was very insightful about how best to communicate with people who have lung health or chronic lung health conditions. I feel like before I really entered this space, my perspective was one of, I had relatives. I had an uncle who passed from lung cancer. I've had family who has had a history of lung health issues. And I think as a child and a young adult, before I really lived in this space, my mother was an intensive care unit nurse for over 40 years. I was nervous around people who had vulnerable health. I was nervous around people who, I was worried about fragility, right? And the more people I meet in this space, the more I see that these are some of the strongest people that I've ever met in my life. And that's really inspiring for the work that I do. And I think to myself, you know, I don't ever want to lose anyone who's a friend, but it happens to all of us. And if I can help continue the drumbeat for the things that we all need to work on as people are dealing with these disease processes, I will do everything I can to continually fight for that. That's the lesson that she has taught me, you know?
Yeah. Wow, that's a very inspiring story, and I think it's beautiful to see how you used, where you were, the organization, and the resources you had to empower and uplift her in a time where she couldn't do that maybe in person. And Kelly, I'd love to know more about the work that Respiratory Health Association is doing specifically around lung cancer. If you'd like to share, I know there's been some recent initiatives.
Yeah, we are always supporting lung cancer research. As I mentioned before, we have linked into an organization that works with clinical trials. This past spring, we worked on legislation that was looking to provide more information around the access to low-dose CT scans for people who fall in the category of needing to be screened for lung cancer. And that created a really great forum for us to be able to discuss with some hospital systems around here, some other advocacy organizations, and even a call that I had with a doctor who works specifically on lung health to make sure that we understood the barriers to that screening and the understanding of what needs to happen to get people into those screenings. And I think that where I live in Illinois, which is where the legislation was at play, it is really different. Like a person that lives in Chicago is very different than a person that lives in Peoria or a person that lives in the middle of the more rural spots in Illinois. So there was conversations a lot about helping provide information to places where people aren't necessarily continually going to the doctor, or where they have different kinds of interfaces with the community, and that doesn't necessarily include a healthcare system. Just really understanding that the barrier might exist in rural Illinois for someone to physically even get to a doctor's office because of their limitations for travel, especially if they're ill or they're elderly. Understanding if that's part of the process, or understanding if it's about them even knowing about it, or understanding what it entails, because a lot of times, like I'm sure you have talked about before on your podcast, there's a lot of fear about getting screened for cancer. So really understanding that, especially with lung cancer, early detection is really key. So making sure that people understand that, the more you know, the better your health outcome can be if you have a lot of information going into it, and really just trying to really grasp comprehensively about how to approach it and educate people, because we're lucky that we live in a place where screenings exist and are either very low price or free. And we want to make sure we get as many people in so that we can catch this disease, and we can get people into the treatment programs that they need to have a better chance of survival.
Yeah. Wow. And what I've noticed in a lot of your descriptions of your work is you really get down to observe and see how you can overcome the barriers that people are facing, versus just, releasing one thing out and saying, this is enough. I feel I've noticed in your sharing about your work is that there's a lot of awareness that not everyone has the same access to information and resources, right?
Mm-hmm.
Yeah.
I really ache to create community at every level of my life. I'm sure my children are tired of hearing about it, and my husband and my coworkers, but I really believe that human connection will save us, metaphorically and literally. And I really want to make sure that conscious effort is present in all of my work. Like my favorite part of my job is connecting people to resources. I literally love being able to flip through a notebook and go, I know somebody. Hey, wait, I know somebody that can deal with that. I know I have a person that can answer that question. I love that, because so many times fear is created by lack of information, lack of exposure, and whatever I can do to help throw those curtains wide open to shine a light on something and allow people to get past that fear and into action is just, it's my touchstone. Like I don't know how to live without continually doing that.
Yeah. That's really powerful. And I think one connection can change so much for one person or a group of people. So when you have passion behind that, you'll work through whatever you need to find the right thing for them, which is really powerful. I'd also like to ask, I know on the website there's information, resources about clinical trials. While working in this space, what have you noticed about clinical trials, and how they serve patients, or maybe barriers around them, or exciting things happening with them? I know it's a small part of your work, but part of the lung cancer branch.
Yeah. I think for me, I like you said, like it's a small nugget of my work, and my emphasis is definitely not in the process of connecting people with those clinical trials, but anecdotally, and from what I've seen and talked about with our constituency, in fact, she's not able to work with us anymore, but one of our employees had lung cancer, and just really understanding, I think about my sister used to work in a cancer center as well. And as I said, my mother was a nurse. And I think
Mm-hmm.
the biggest barrier that I've ever seen about any of this, even which is partly why we created our COPD toolkit and partly why I send out updates about policy,
Right.
it's like, if people don't know about it, they can't try it, right? If people don't know that it's possible or it can exist for them, they don't have they have a barrier. So I
Mm-hmm.
really think that comprehensively understanding how to connect people to things that might help them in a way that's not overwhelming is
Mm-hmm.
huge. I mean, I've been lucky enough, knock on wood, to not have a chronic health issue like that needs to be addressed. But like everyone has barriers, right? Like one of my children has some neurodivergency that we wanted to make sure that we are paying attention to and have resources for. And there's a lot that happens at the beginning of that where you're like, I don't even know where to start. So I can only imagine what happens if it's actually like an issue that could cause your demise or could create a lot of problems for you, like being overwhelmed and dealing with the emotions around that. Having a tool or a person on our website, it's a link. I know that there's a lot of work that your organization is doing that's critical, that's like demystifying the process and allowing easier access to it, and really like I said before, opening the drapes on here's what exists, here's how to find what you need, here's how to poke through it, and if somebody wants to reach out to me and help them review that or troubleshoot it, like I think that is really, really, really important. And I think that is the biggest complaint that I've had. I mean, you can equate it to some of the advocacy work that I do too. It's like, if people don't know how to access a program, they don't access it. The program doesn't get used, and then the program shuts down. So if you
Yeah.
can help make people aware of how to get there or what to look for, like that's the biggest barrier. What do you even what do you look for? Who do you ask? Like, I think that part is the part that I have been told time and time again through all of the issues that we deal with is, I don't
Mm-hmm.
know where this information exists. Can you help me? So I think that part is the barrier for especially for lung cancer, especially for clinical trials. Like, how do you push through the knowledge that you have a potentially fatal illness and get to the headspace where you're like, nope, I'm going to solve this. It's not going to be fatal for me, or I'm going to throw all of these tools at it and see what happens. Making sure people know how to start that process is critical. Removing and demystifying the fact that clinical trials even exist. I don't even know that I would know how to start that process. So groups like yours that work on that and RHA's work on that, I think is really critical to improving outcomes.
Definitely. Yeah, you really you got it. Access to information, not being overwhelming. I mean, those are things that seem so simple, but especially in a world where we're lucky to have access to so much information, it can be overwhelming. You don't know where to start. So I'm glad we're both doing work towards that. And I'd also like to just, if anyone that's listening wants to get in touch with you or the organization, what would you say is the best way to reach out to um, RHA and get involved and talk to someone if they need?
Yeah, well, my information is on our website, which is www.resphealth.org. If you go to the staff page, you can find me, and I'm pretty sure there's a click through that'll give you my email address. And anyone that wants to can reach out to any department at RHA and inquire about any of the things that we've talked about. And I would love to I would love to connect with anyone who wants to know more about this. Clearly, I like talking about it, and clearly, I like people. So reach out to me if you need anything.
That's great. Well, we love talking to you today, Kelly, and thank you so much for being here and sharing all of your experience and wisdom and passion with us. It's definitely energetic and contagious. Um, so, really appreciate your time, and thank you so much for being here.
Thank you. I really appreciate you having me and being able to talk.